Thank you, Mr. Chairman. Madam Secretary, I'm receiving calls, increasing amount of calls and correspondence from my constituents who are concerned about what to expect come 2014 with regard to the ACA. Many are concerned that the law means higher costs, increased taxes, and less jobs. As a matter of fact, I have a tweet here from the Kip Wilson. She wants to know why middle-class workers are going to be subject to increased premiums and more taxes under Obamacare. I keep hearing that. Yesterday, in your testimony before the Senate Finance Committee, your responses left one of the law's leading architects to conclude the implementation of this law might be, quote, a train wreck. I must tell you, that leaves me, my constituents, and the American taxpayers with even less confidence that we had before the law was passed, and which I guess it's beginning, we're going to launch it October 1st. Secretary Sebelius, I want to give you an opportunity to respond to the questions raised yesterday by the Senate colleagues. With thousands of pages and regulations issued, hundreds written of new Washington acronyms, and uncertainty mounting, can the Department share a written timeline and implementation with this committee to the American people so they can better understand what the administration's intent is and what they can expect? If you can elaborate on that, I'd appreciate it.
Yes, sir. What I said yesterday and here today and will continue to say is starting October 1st in every state in the country, new marketplaces will be available for open enrollment. Some of those will be federal marketplaces, but contain private market plans, choices, and competition. And some are going to be run by the states. In advance of that, hopefully this summer, there will be individuals trained to answer questions and do outreach so people can become aware of what's developing and the choices they can make for themselves and their family. There is an up and running website with a very clear timeline, healthcare.gov, which gives steps along the way. We will have open enrollment by October 1st, where people by website or on paper can pre-enroll in plans that will be up and running on January 1st, 2014 in every state in the country.
What about, again, the tweet that I just received at the Kip Wilson? Are we going to be subject to increased premiums and higher taxes under Obamacare?
Well, the insurers right now, Congressman, are just beginning to file their planned rates for the new marketplaces. There is then a negotiation period either at the state level or with the federal marketplaces about what those rates are. So I think it is any description of what people will be paying, I think, is just invented at this point. The rates are not filed. They are not certain. And we are very confident that not from our standpoint, but from the Congressional Budget Office analysis, that the combination of competition, elimination of a lot of the overhead costs, and subsidies available to a lot of these Americans who for the first time will have full insurance coverage, they will be looking at a much more competitive rate and lower prices than they're paying right now if they have insurance coverage.
So you don't anticipate increased premiums under Obamacare?
I do not anticipate the kind of rate shock that people are describing. And again, there are no rates filed, so anyone who is giving quotes about what rates will be paid is just really inventing that.
Thank you, Madam Secretary. Next question. According to the reports, HHS believes it has the authority to shift money from certain accounts to fund any remaining expenses related to implementation of the new health care law, specifically from any non-reoccurring expense fund. Yes or no, do you believe you have such authority to shift funds between HHS accounts to cover expenses related to implementation of the health care law? Yes or no, please.
I do have legal transfer authority that is part of, and it is limited. The non-recurring expense fund is a specific fund that Congress established within the Department of Health and Human Services that is for one-time IT costs. So those are two different things.
Can you please provide a list of the authorized accounts you believe you have the ability to use to make such transfers for implementation purposes and accounting of what funds have been transferred or used for such purposes, and also the legal analysis for such authority.
Sir.
Can you please provide that for me?
The gentleman's time has expired.
Thank you.
We are voting on the floor. We have 8 minutes plus.